Hey, welcome to another edition of the Leadership Studio. We have with us today Les Cave, who's the head of the CHRISTUS Foundation here in Houston. I've known Les for a long time, and I know you guys are going to really enjoy him tonight as well. And for those of you planning, next week, of course, we're going to do the Spaghetti Warehouse deal right after class, so I know that you want to put that on your appointment calendar. So we're going to talk to Les a little bit. Les, thanks for being here tonight.
Hey, it's my pleasure. I appreciate the invitation. I look forward to our discussion here.
Yeah,
Bob.
the class is tweeting away, so I know that they have a lot of questions for you.
Good.
So that's good. Or they're trying to make up for extra credit, one of the two, but I know that they're very interested.
Yeah.
Les, tell me, you've done a lot of interesting stuff around development. I've known you since you were at Rice, when I was at Rice. That's
in the 90s,
yeah, back in the day, right?
Yes, yes.
But you have worked on the fundraising side. Now you're working for a foundation in sort of a mixed role.
Right.
Tell me a little bit, if you were writing a book today, Les, on the fundamentals of development from Les Cave's point of view,
Right.
what would be some of the chapters?
Good question. When I started out, it was almost like starting in the garage. It really was. I was working for an organization that was a very small budget, and I traveled a great deal, and so the third bedroom of my home, or our home, was my office.
Wow.
And really was literally raising enough money to pay my own salary and then to provide for the needs of the organization. And those were in the undeveloped world, what we called it in the third world.
Yeah.
Healthcare, where we would try to bring primary health care into remote parts of Africa, Asia, and so forth. And so it was fascinating work. So I would, getting started, that would certainly be something, getting started there and understanding the fundamentals of fundraising. And, I read, there's great books written about fundraising, but there's three common principles.
Yeah.
A good cause, a stated goal, and a timetable. And that's why somebody like the United Way is always able to real clearly communicate what they're doing, because they set their goal.
Yeah.
This is what it's going to do, and our campaign is going to run from this date until this date. There have been great studies in fundraising showing that if you don't have one of those three, you're probably not going to be successful. If you don't have a real good organization, even though you have a stated goal and a timetable, if you don't have a timetable, people say, well, I'll give next week, I'll give next month, I'll give next year. Or if you don't have a goal, they don't see how well they're progressing toward that goal. So that's what you get started with.
Do people in terms of those people who give, do they like timelines? They like to see what you're going to do.
We all do.
Yeah.
We all do. We all need to, if you look at Macy's, sale ends such and date. You need to come in and shop by this date, or you're not going to get these shoes at this price. And so, we all need those. We do need those timetables to act.
Tell me about sort of your beginnings then in fundraising. I mean, how did you get involved in did you grow up in Texas, first of all?
I grew up near Corpus Christi, so yes, I grew up in Texas. And
what town near Corpus Christi?
it's a little town called Sinton, Sinton. And it's rural farming, oil and gas, ranching community, really a nice place to grow up. And then moved to Houston in '75 after college. I went to school at Sam Houston State and came to Houston. So I've lived here since '75. And my first work out of college was in fundraising, no, it was in banking, and then in sales. And in sales, I really enjoyed measuring my success. How much dollar volume did I sell? How did I do? And I learned really to get over some of the fears of making presentations to people, of asking people to make a decision, and then to got satisfaction out of the progress that I made and the things that I was selling. And then in the late '70s, we had the Cambodian crisis, where we had the killing fields in Cambodia, and they began to say that a whole generation of Cambodians has been wiped out. A whole generation is lost. And I began to think about that and think, I enjoy sales, but is that really going to have that big of an impact for me when I'm sitting on the rocking chair as a retired individual? And I realized it wouldn't, and so I began to seek ways to really have more of an impact in the world. And so I met this fellow who was with an organization, and he told me the stories about what they were doing in places like Haiti and in the Congo. And
what was the organization's name?
It was called the Medical Benevolence Foundation, connected to the Presbyterian Church, trying to get physicians and other interested people supporting the healthcare in some of the countries where the church was active.
Wow.
And supporting the national leadership in those countries, doctors, nurses, universities, hospitals, and so forth. And so I said, if a job ever comes up that you hear about, let me know because I'm very interested. And sure enough, one came up. And so I began doing work very similar to that. And did that for about 5 or 6 years, raising money, really just using my same techniques that I used in sales.
Did you find it an easy transition going from banking to fundraising?
No, it wasn't that hard because once again, I was looking to achieve, I was looking to measure some kind of achievement.
Yeah.
And if it was more than just going out and talking to people and making friends, I really did need to take care of $200,000 worth of medical needs in various countries. And so really had to talk to people specifically about specific needs and specific goals and timetables. And so you find that you think you're good at it.
Yeah.
And then in 3 years you realize you weren't very good at it, but you're getting better. And I still feel that way. I mean, it's been 30 years now and I'm still learning. I'm still reminding myself of all the fundamentals.
How long did you did that for about 5 years, and then
years.
what did you transition into?
There was an organization here in town called Private Sector Initiatives, PSI. That was a great organization during the Reagan era. President Reagan wanted to turn more care and social responsibility back into the community, so that if your community had an issue, a need, it didn't have to go to Washington to be solved, and then the money flows to Washington and then comes back to Houston. And so a group of business leaders put together private sector initiatives in Houston, and I worked for them and helped it was in '86 when the real estate crisis and the oil crisis and all that happened, and so we were working to help employment. And so I worked here in Houston. And then after that I went to Rice University when you and I met in the early '90s.
And what was that transition like for you from two fundraising organizations to now sort of this big juggernaut of a fundraising operation?
Well, it taught me everything it showed me everything that I didn't know. Because here were people that I worked with who had come out of other universities and universities really have the leg up on the rest of the organizations on alumni and fundraising and having divisions of labor in their fundraising. And so I worked there in really an organized, sophisticated fundraising shop. And that was just excellent because I was able to see how a planned giving program worked, how you build an individual giving program, how do you do an annual giving program, how do you have these events for donor recognition and donor cultivation, how do you engage the president at the right time, and how do you, what is the job of the development person and what is the job of the top official or the dean. And so that was wonderful for me. I don't know if I would ever be, if I could ever do what I'm doing now if it wasn't for those 5 years at Rice.
You learned a lot there.
I learned a lot there, and we did a lot. We helped raise money for the Baker Institute, for what's now called the Duncan Hall, which is engineering school, the chemistry building, which at that time was all aimed at nanotechnology.
That's right.
And so we accomplished quite a bit there in those 4 to 5 years, and I learned a lot. Very fortunate for me.
Do you think that sort of in the growth of a development professional, the idea of working at an organization like a Rice or a Texas Children's or an MFA or the United Way, some of these really big types of fundraising organizations, it can really help you sort of as you do some of the other stuff?
Unquestionably. I took sort of a slow road to get there, and if I had started with a university or a United Way organization, it would have been a much quicker track. And so yes, there's where you can work alongside of people who have that special knowledge to do estate gifts and have that special knowledge to understand how you organize an annual giving program, and work along people who may have more experience out dealing with individual gifts or corporate gifts or foundation gifts. And if you have the curiosity to grow yourself professionally, you have every opportunity there to work alongside of really the major components of a good fundraising program, and come away from there being able to do a lot of that yourself like you would in a smaller organization, or in a larger organization maybe help coaching some of the people who are working with you that haven't been in that organization
Yeah.
like that before. So priceless, absolutely priceless.
One of the things that we've asked a lot of people sitting in your chair during the semester is to talk about sort of the very good, sort of the overperforming, overachieving fundraising organizations in town,
Yeah.
And some of the underachieving. What are the elements of the underachieving? And inevitably they talk about the Rice University and the Texas Children's Hospital and MD Anderson, MFA. Do you think that those places, it's all because they have the staff and they have a lot of experience? Is that what it's all about? Or is it something to do with their mission? Because those are different missions.
Well, they've, and you'll watch if you see those organizations within their staffing and in their leadership, they have their ups and downs.
Yeah.
I agree with all the names that you just mentioned. They're first rate. The United Way, of course, is somebody who can go out and raise $70 million every year, year after year, and do all the things that they're doing. That's just phenomenal. Because you look at some other organizations, they'll raise $70 million, but it'll be over a 5-year campaign. And Rice, the United Way does it year after year after year. You look at what MD Anderson has done. Pat Mulvey has been the vice president of fundraising there at MD Anderson, and it's just phenomenal. It was a while back, but at University of Texas, and I won't say this about MD Anderson, University of Texas, they basically had a phone number, and if you wanted to make a gift, call this phone number, and we'll take your gift.
Yeah.
But now they've really turned it into a donor-friendly, alumni-friendly, community-friendly organization that has it all divided up across the country, has it divided up among the different ways that people can give, and they are raising a lot of money to help with cancer care and cancer research. And so there's another top-rated organization.
And MD Anderson is part of UT, and it's very interesting, right? There are very few large public universities that do well. We can name them, right? Michigan and the University of Virginia,
A&M,
UT are sort of unusual, right? In terms of public universities that do well fundraising-wise.
And that's what we've always admired about universities is that when they are hiring a president, they're very clear. The president is going to spend maybe half of his or her time out talking to the alumni and talking to the community leaders about fundraising for that university. And in hospitals, in a lot of places, that's just not the case. You hire a hospital CEO, and they're going to really make sure the trains run on time, that the costs are low, and that the physicians are happy, and that the patient satisfaction is high, and so forth. And trying to squeeze in some fundraising is very difficult. So in the healthcare environment, we're still playing catch up to what the education sector is doing. And of course, the education sector has this constituency. They can look at, if you're really targeting and fundraising people who are in their 60s, they can go back and look at the graduating class and say, here's the 60-year-olds right here. And so that kind of gives them a little advantage. But we're all trying to catch up with what the education sector is
Tell me
doing.
about the CHRISTUS Foundation. How long have you been at CHRISTUS now?
This is my 11th year, Bob.
You've been there a while.
I have been there a while. Tell you a little bit about our foundation. We're in the healthcare arena, and this foundation is in the healthcare arena for caring for people who are uninsured, people who are low income, and in Houston we are uniquely identified as the highest population of uninsured people in the country.
Yeah.
And our Medicaid requirements are so strict that it's hard for people to qualify for Medicaid. And if you're a child, if you're a pregnant woman, then you can get Medicaid. But if you aren't either one of those, you're going to have a very difficult time getting
And
care
Texas
through
continues
Medicaid.
to make it very difficult.
Yeah, we do. There was an opportunity to expand the Medicaid rolls, under the Affordable Care Act, and we passed on that. And so, meanwhile, our fees that we pay as part of the Affordable Care Act for the hospitals, we pay the tax now that's part of the Affordable Care Act, are going to the states that did expand Medicaid. Right. It was kind of a deal. The deal was the hospitals would accept a reduction in reimbursement from Medicaid because more people would have Medicaid and be able to pay something. That was the long and short, simple deal. And so the hospitals got the reduction in the reimbursement on Medicaid, but we didn't get the people who qualified for more Medicaid, the increased coverage. And so the same uninsured people are left coming to the emergency departments or being critically ill before they finally show up for care. And our foundation is now working to, and it has been for a long time, working to try to prevent that. You know, we have access to primary health care so that people with diabetes can manage their diabetes. High blood pressure, the same thing. Cholesterol, the same thing. Immunizations for elderly people, for flu, for shingles, for pneumonia. School clinics so that children don't have to miss school so much and parents don't have to miss work, because that can be devastating to a family if they have a case there. And you see a lot of this preventable.
Right.
You go into the emergency departments. First time I went into the emergency department at St. Joseph Hospital, I thought it was going to look like the TV episode ER.
It doesn't.
It doesn't. They're in there with tissues, and they have colds, they have sore throats, they have upset stomachs, or they might need sutures on their hand. And then the ambulance brings in people in the back that you never see in the front room, of course, but the emergency department has become the primary care center for a lot of the population simply
If you don't have insurance, if anything goes wrong, you go to the emergency room.
And every now and then a physician will say, you know, I can't get you into a certain specialist in any good time, and you really need to see somebody soon, so you better just go to the emergency department because they have to have all those specialists on standby ready to see.
Now tell me how your foundation sort of supplies this. Is it all through the San Jose Clinic, or tell me some of the outlets for you guys?
Well, we have a good collaboration with San Jose Clinic. When St. Joseph Hospital was sold, we came up with a plan to continue to provide health care in the downtown area for uninsured low-income people. We built this beautiful building, we fundraised for it, and we invited San Jose Clinic to use that as their new home because their other building was really old. I mean, they were doing such wonderful things in this building that was you know, just really it was surprising what they could do in there. And so we thought, boy, we give them more space, think of what they can do. And sure enough, that's what they're doing now. So we work closely with San Jose. And at the same time, we have mobile clinics who go out into areas and serve a lot of seniors. We have primary care clinics, which become medical homes. We have school-based clinics in some inner-city schools where they didn't have school nurses. And like I said, the opportunity for kids to miss school and the parents to have to stay home. These are all elementary schools. It would just devastate them financially. And then we have some special programs in adult literacy, some special programs for homeless in Galveston, and then we work in collaboration with other organizations. So last year we served through patient visits just over 60,000 people. And so that was a milestone for us, and we're continuing to grow after that because we still have the same uninsured people in town, and there's no need their diabetes, complications, leading them to the emergency department, leading them to hospitalization, or maybe the loss of an eye or loss of an organ or loss of a limb. And so we're trying to coach them, help them, care for them, and it's affordable. What works best is when people have a little bit of their own investment in their health care. And so when they come to our clinics, St. Mary's Clinic, which is in Houston, Point of Light Clinic, which is in Dickinson, they're asked to pay $35. If they can't pay $35, we talk to them about what they can pay. If they can't pay anything and they need care, then that's not going to stop them from seeing the doctor. People see us by appointments. We have space for walk-ins, but it is just like any doctor's office.
And these are all places that the CHRISTUS Foundation funds.
Yes.
You sort of keep these doors open.
These are our operations.
Yeah.
And the same thing with the mobile clinic, which by itself sees over 20,000 people a year with a lot of immunizations, well woman care, and so forth. Once again, it's all affordable.
Yeah.
But that's what the community needs. You know, we have a lot of small businesses in this town that don't have enough employees to qualify for group insurance, and so they're all on their own.
Yeah.
Maybe the business gives them a little stipend to go find insurance, but insurance is expensive.
And so they're using your facilities as well.
Yeah.
Now, in a sense, when you talk about the CHRISTUS Foundation, you know, the first thing that I'm sure pops into people's mind is, okay, you have a bunch of money and you give it out, but you do a lot of different. You also raise money, so you continue to grow the foundation.
We're partners with our donors in what we do. Our budget is just under $5 million, and so we have funds that we spend. We have a spending policy on our programs, and then we raise funds for our programs. It's about 50-50. So that, to use round numbers, $2.5 million of ours goes into funding the programs and the administration. $2.5 million in funds raised goes into the programs. So, so we're in this with every donor that gives us.
And you do give out money to certain partners.
Once in a while.
once in a while.
What we like to do is identify where we can collaborate. You know, if we see an area where our mobile clinic can collaborate, for instance, with the American Diabetes Association. They have these wonderful health fairs, and people come in and learn all about diabetes, and then they have screenings, and our mobile clinic team goes in there and has screening sessions to help people identify. There's no symptoms that you get with diabetes, really. There's no symptoms that you get with high blood pressure or high cholesterol, and so it takes really some simple test, very inexpensive test, and then you can help people correct and then manage all that, and that's what we do. And so we can collaborate with schools, we can collaborate with other organizations. We look to do that, and then we help fund those so that we have a partnership with them. It's not a legitimate legal partnership, but it's an affiliation with them.
Sure.
Yeah.
So when you go out to visit people that you want to raise money from, I mean, are you basically selling these exact same services, and you're saying it's sort of going through the foundation? Is that how it sort of works?
Yeah, it's what we hope to do in our work, whenever we're talking about fundraising, is to go out and identify people who have an interest in healthcare. Maybe it's for the elderly. Maybe it's healthcare for children. Maybe it's chronic diseases. Maybe, you know, whatever it is. But we try to identify what it is they're interested in, and then take them to one of our sites and show them what our foundation is doing through the services we provide for the elderly or for the children, or some special program. And they can actually have a chance to talk to the staff who's there. And this is a warm, caring staff. You know, we're a Catholic organization that does this faith-based and out of our hearts.
Yeah.
And people really cling to that sometimes, and certainly our patients do. And so it's a certain person that we identify. Not everybody that we talk to. Maybe 1 out of 4 or 5. Who really finds that this is what they want to help us do, and they'll support that clinic. Or
And are they usually Catholics?
No,
not usually.
Not at all. We don't ask them. I don't.
Right.
I don't. Certainly our patients aren't Catholic, and certainly our staff aren't.
Right.
We don't.
It's
know.
a Catholic organization, but you're serving everyone, and you're inviting everyone to be a part of it.
We are. We really are.
I want to talk a little bit about your staff and then your board. So what does your staff look like, Les?
We have in our administration we have 10 people, which includes an event person, 2 major gift fundraisers, an accountant, and a CPA. CPA is part-time. We have a person who is over our outreach, our programs, director of our community outreach. We have an office manager, and then we have kind of a person who works as our chief development officer and prepares all the grants, oversees the work that goes into our donor database, and then I'm there to oversee that, but also to pitch in with the administration and the fundraising.
Yeah.
And so then out in the field, staffing our clinics and mobile clinics and school-based clinics and other programs, there's 37 other medical staff, including physicians, nurse practitioners, medical assistants, social workers, counselors. So there's a total of 47 of us.
But if you're going to a big foundation to try to get a big grant, is it you, Les, that's sort of leading the charge? You're the most charming of the group.
Well, those are your words, not mine.
I've not met the others, so I don't know.
We have this fantastic board of directors, and they're so helpful. And so it might begin that if you look at a foundation and you see who are the directors of that foundation, let's just pick one. Let's pick the biggest one out there, Houston Endowment, and say, okay, I know X on the Houston Endowment board. Why don't we sit down with X and let's talk to X about what Christus Foundation is doing and see if they think it's something that we ought to present to the foundation. And so that's how we do it first. And then they say, yeah, this is something that we fund things like this all the time. In fact, we're going to have a board meeting coming up, and our deadline is this, so why don't you prepare a proposal, and I'll introduce you to the staff person that you'll be working with, and then I'll typically work with the staff, but the board, our directors really help open a lot of doors for us.
How big is your board?
We have 40 board members.
That's a big board.
And we have probably 10 life members that are very active also, and advisory council members who are, so we have probably 50 people out there helping us do our job.
A strict fundraising board, if you will, in a sense?
No, they oversee, as that board, they also oversee our budget, the finances, they oversee our nominations, they oversee our investments, they oversee our communications and fundraising programs. So they have a fiduciary responsibility besides their fundraising.
They're a governing
interests.
board.
Yes, they are.
And do they have a responsibility for a certain amount? Does each, you know how some nonprofits, foundations will say, as a board member, you're responsible for a give or get of at least $10,000 or $5,000 a year. Do they have that?
We have agreement with our board on making a gift and supporting the foundation, but we don't have a number that they must do.
It's just a meaningful gift.
And our board is 100% supportive of what we do. And that's important.
Yeah.
You know, many times when you're filling out the questionnaire for a grant request, that's one of the questions they'll ask. For example, our building that we have now, that purchasing the property and building this 55,000 square foot building cost about $18 million. Of that $18 million, it was between $5 and $6 million was contributed by our board. So our board is with us.
They're very invested. They own they understand that ownership.
And what's so fun is that I can go to a meeting and we'll sit down with X and I'll start talking about what we're doing, and the board member is so familiar with what we're doing because of all the time that we spent in meetings and in site visits, that they'll just take over and they can say, oh yes, and this is what's happening at this clinic, and let me tell you what our goals are, and tell you a funny story about a patient that came there one day, and so they're quite literate in everything that we do, and quite good at explaining the stories.
Wow.
We're very lucky.
What's the biggest mistake that development people make in approaching foundations in your experience?
Gosh, I don't know what the biggest is, but I guess one of the biggest is to take a cookie cutter approach. You know, to think that this worked on X foundation, so it's going to work on Y foundation. I'm going to send them the same thing, and I'm going to ask for the same amount, and to not really make it individual and personal, because the foundations aren't the same.
We even heard from Linda May from the Simmons Foundation. She said she's received, "Dear Linda," and then deep into the letter, "We really are appreciative of the Houston Endowment for." So talk about your cookie cutter approaches. But you can see that happening, right?
You got to proofread. You got to proofread these things. You know, your case may be the same, but you really have to make sure that you emphasize what are the interests of each donor, potential donor. And so I think that cookie cutter approach gets people in trouble. I can tell you a story about a foundation we went to when I was at University of Texas Health Science Center. And we got to know them very well, and they said, there is no use asking us for anything more than $500,000. We just don't make gifts larger than $500,000. And so we talked to them, and we came up with something. We presented that to them, and I think that they gave us a nice gift. I don't know if it's $500,000 or not, but another organization, which we knew very well, we found out this later from that foundation, asking for $10 million. And come to find out, the reason they asked them for $10 million is because they had a quota system. This development director had a certain quota of proposals that they had to get out there, and when the foundation saw this $10 million request, they just threw it out the window, because the person really hadn't taken the time to know the foundation before making the request.
To know that any request higher than $500,000, they were going to say, this guy doesn't know us.
Yeah. This is a stranger. And so you really can't take that cookie cutter approach. I think that, and I think the other side of it is the stewardship on the other end, is after the gift is committed, to inform them of the impact of that gift, how it's been used, what the timetable is, and really contact them at times when you're not just asking them for money, because that's the one thing that I heard from the start, is that only time I ever hear from you is when you need money. And that hurts, because it's really not the way that you think, but when you look back, and what you're measured on is how much money you're raising in many cases, and not measured on how many thank you notes you mailed out or how many site visits you took to a donor after they made the gift. And so we had to change what we are measuring, because that's what we're going to do. We measure now how many visits that you make with a donor to tell them about what their gift did and what a big impact it has. So.
And large organizations are able to have a director of stewardship, or someone who just is in charge of that.
Sure.
But for most nonprofits, which are development offices of 1, 2, 3, you know, they have to remember to do all these things. And it's very important that they do that. And it's not only important; it's probably a good idea to sort of develop that relationship, that partnership. And
really, I would, one of the best fundraisers, I think, was a gentleman at Rice University before there was really a big development effort there, and his name was Bill Akers.
Oh yeah.
And Bill ran the fundraising for rice for a long time. And what Dr. Akers did, he was a professor in the engineering school, identified the top 100 donors to rice and decided, I'll have lunch with one of those every day. One of those people every day. Every day I'm going to go to lunch, I'm going to go meet them, and I'm going to talk to them, I'm going to get to know them, and we're going to talk about the university. If that's what you did, that would be a fantastic fundraising program. It really would be. Ask them for a gift. If you talk to them enough, then you tell them about what the university is doing and you tell them what the university needs, they're going to be responsive.
Yeah.
And so, yeah, I think
people want to hear about that stuff, and they like visiting over lunch. People don't care about a free lunch. And, that's one of the things that you learn very quickly. Can I offer you lunch? No.
Yeah.
But they don't mind visiting, and developing relationships. That's good.
Yeah.
So a lot of questions have been tweeted in,
right.
questions for you. The first one that we received this evening was from Marta Alvarenga. She wanted to know about your spring luncheon. I guess your spring luncheon this year broke all records. You had a celebrity guest.
Right.
How'd that work out?
That worked out exceptionally well. It was sold out a month before. We were thrilled.
Was this the Jim Belushi one?
Jim Belushi was our speaker, and every year we have this fine spring luncheon at River Oaks Country Club. We've kind of chosen that as our destination. Not the biggest place, but it's very personal. You can have 500 and 550 people there, which is a nice crowd,
nice, yeah.
And they can get to meet the celebrity and have their photo taken with the celebrity and really be in a pretty good seat to be part of the program. And we identify people in the community we want to recognize to have been very especially helpful to us and helpful to the community. And so this is our 10th, I believe. We started out doing that really as a communication measure because we felt like we just weren't getting our story out there. People didn't know who we were. And so it started out like, well, if we raise some money, that's fine, but if we can attract several hundred people into the ballroom and have a chance to talk a little bit about what the foundation is doing, it's worth it right there. It's just good visibility. But now we have it both. We have the visibility and we have fundraising.
Let me ask you some specific questions about, because we've had a few different people from different organizations that have been very specific. From Catholic Charities, they were very specific about, and it's useful to talk about the events. So when you do an event like that, is it all about, are the chairs sort of an important part of that for you?
For sure.
So who were your chairs for the Jim Belushi event?
We had Betsy and Hunter Nelson, and then we had Alan, Donna, and Al Clay.
Okay.
And
were they responsible in a sense for making sure that, is that why you broke all records? Because they sort of sold a lot of tables to their friends?
Well, we honored the Doherty family, the Robert Doherty family, his daughter Madeline Ferris and one of his sons, David, because of their service to the foundation. The father had been on the foundation, the daughter, and then the son. And certainly they have a strong following out in the community because while they're very active in our foundation, they're very active in a lot of places. I remember David talking about all the Little League teams that he coached, and Madeline has been on the board of University of St. Thomas, and so they have a strong following in the kind of leadership and service that they provide. So you combine, really results-oriented chairs with really heartwarming story of the family that you're recognizing and Jim Belushi, and it turns into a great combination for you. And it helps us raise money. And the money that we raised this year was for our mobile clinic. We have a Healthy Seniors program where I talked earlier about flu vaccinations, shingles vaccinations.
And so that helps pneumonia, too, to have a sort of a nice message out there.
We think so.
This is what you're supporting.
We think so.
When you meet with your chairs, when I meet with chairs, I will say often, we're probably going to expect, usually our chairs bring in about $100,000 in terms of their friends. Are you that specific, Les, when you talk to them?
Well, usually they ask us, they say, what's the best we've ever done?
Yeah.
And so this
last year. Better. You're better than this than I am.
What's the best we've ever done? And so our best so far was like $320,000. And so we certainly want to do better than that. And so they keep checking. How are we doing? What's the number? What's the number? And so we, at the end, it was, even after the sellout, we had people still calling in or getting on the website and making contributions even though there weren't seats available. And so it turned out to be $350. And so they set the new bar. Now the next year's chair is going to look at that and say, all right, let's roll up our sleeves, let's get going.
That's very nice. We just had our big event this last Friday. We brought in Kool and the Gang. Ooh. And that was very...
That'd be a lot of fun.
We did it at the Verizon Wireless.
When I was in college,
that'd be a lot of fun. Yeah, it is an old man.
Yeah.
So And one of the questions that one of the students had, I noticed, was that they wanted to know, how do you get Jim Belushi? And how was it for you guys? I mean, sometimes people use booking agents or someone knows someone. And
That's how we found Mr. Belushi. But we have guidelines on how we are going to select our speakers.
Yeah.
But we do use a booking agency, and some organizations just have these wonderful contacts, and they can pick up the phone and call some celebrity and say, "Are you free this weekend? We want to have you here for a fundraiser," and they get them that way. But we work through professional agencies, so it probably costs us a little bit more.
Yeah.
But then you have a contract there that says they are going to be here or else, and so there are some things there that make it a little bit more businesslike than other. But Jim Belushi does this for other charities, especially where he lives out in California, and he's just fantastic at it.
Very
really,
nice.
you just look at the photos, you look at the program that he put on. It was really better than what we ever could have dreamed of.
The best speaker we ever had at a luncheon was Barbara Bush.
We had Barbara Bush.
She was fantastic.
We had Laura Bush.
Yeah, Laura Bush.
She was fantastic
Yeah.
too. But
So,
how can you top
good.
the Bush family?
Nicole has a great question. She wants to know about what personal qualities and skills does your staff need from you for them to be successful?
From me,
Yeah.
advice. I think they need somebody who is going to be able to share some of the things that have worked, and I think they need encouragement. I believe they also need a vision. Sometimes we get so busy doing things in our organization that it's just like nothing new. Oh yeah, we're gonna buy a new mobile clinic so we can serve another 10,000 people a year, and you just talk about this enough that we don't realize that there's a lot of people that don't know it. And so I really have to sit down with the staff every once in a while and I say, if you need something new to talk to your donors or your prospective donors about, here's what's going on. Here's what we're talking about doing. Here's some of the results of the things that we did, because I get to kind of have a foot in every part of it, the clinics, the board, the fundraising, the administration, and so really to help connect all those dots with them and to give them what they need, especially the fundraising staff, to go out and talk to donors and really engage them, because you really have to have a reason for a person to get together with you, and we try to give them valid reasons to take that person out to the site. So and then we really have to set goals. We really need to work with them to set reachable but ambitious goals, because what we're doing depends on us reaching those goals.
Absolutely.
Yeah, there's really no alternative.
I think that's something that sometimes escapes people, right?
Yeah.
Is that the reason we're raising the money is to do all this good, right? And we have to do the good.
That's right. That's right. Yeah.
Amy Guzman wanted to know, when someone is brand new to fundraising, how do they begin to establish these relationships? So if you're in a relatively young nonprofit and you're the new director of development and you're the only person in development, how do you begin to establish relationships?
I've said this so many times to people that we've interviewed and people in our staff that they just start falling asleep when I say it. I look at this as circles. Your board is really your inner core. And so when you first get started, you really need to work closely with your board to make sure that they are all completely familiar with what you're doing, what your goals are, and what it's going to take to reach those goals. And then engage that board in helping you reach that next circle of influence, and then that next circle of influence. And so I think the first thing that you do is really energize, educate, engage your board, and then find out who they know, and let's go talk to them. Let's go take them to breakfast one morning. Let's go meet them out at the clinic one morning. And so a new person, in order to start developing relationships, really needs to begin those relationships right there at the core. That's what I would say.
It's really using the relationships that are closest to you to maximize those.
And it's systematic. It really is very systematic, and it may seem oversimplified, but that's the way to do it. We still do it now.
Kristen Mara has a good question around your relationship with your board. When you're dealing with your board, I mean, what is your relationship? Do you see them as your boss, or do you see them as a colleague? What is that relationship like?
Well, I do report to them, so they are my boss. But since I think if you're a new person on the staff, then you really look at the board for direction. After you've been on the staff for a long time, this is my 11th year, some of the board members start looking to me for direction, and that's really kind of almost a cop-out. You know, we really need the board who is out there talking to their friends in cocktail times and at church to tell us what the community sees as its needs and what the community sees as an organization like, what we should be doing to address some of those needs. And so we relate to our board as colleagues. They are my boss, but we're all really in this for the same reasons, and so we collaborate on our ideas, and we think, maybe if we tried this, maybe if we talked to this organization, maybe if we collaborated over here, you know, that's the board relationship. And then a timetable, you know, because you can get all these ideas, and you have to say, okay, well, look, if this is the 16th. We're going to have Easter coming up, so those are kind of lost days. By the end of the month, let's get back together and let's see what we have done. Let's make sure we get all these things done by the end of the month, so that because a board person is just a volunteer. I say just a volunteer, but they have a life, they have a job.
Most important of volunteers.
Yeah, and so we have to respect their time to do their other things, but we also want to, while we have them for that 3-year term or that 9-year term on our board, make sure that we get them to contribute to the overall, you know, success of the organization.
It's so good when you have a board member, though, that's really engaged, right? I mean, every once in a while you have these board members that are super engaged, and you got to love that, right? It makes a big difference.
It is, you know, and I've been fortunate with the organizations that there always has been that strong group that are really engaged, and then occasionally there's some people that are kind of on the boundary. You know, they kind of think they want to do something, but they're not sure, and they don't want to try to step on anybody's toes in order to do something. And so you have to bring them in and put them around the table with you too.
It's interesting. We let our staff sit in on board meetings, right? So this is sort of an unusual thing, but the board loves it. The staff like it, and it's interesting to hear the staff afterwards, and they'll say, well, they don't seem as engaged sometimes. And it's interesting from that perspective, because you always have that core of people that are engaged, and then some that are sort of sit back, and sometimes the staff don't realize, well, that person you thought was unengaged gave us $80,000 just last week. You know, it's sort of an interesting thing.
That's a nice form of engagement.
Yeah, exactly.
But yeah, you have to watch in those board meetings that they do turn into a chance for people to participate, you know, or not just, we're going to hear from this report, we're going to hear from this report, we want you to approve the budget and do all this stuff. It really has to have that larger discussion.
Sometimes you just have to ask questions of them. And sometimes I feel like I'm teaching, you know, and so Les, what do you think about that?
Yeah, that's right.
But I always feel every time I call on a board member, they always have a great response. You know, it's a really nice thing.
Yes, yeah.
Raquel Ramos had a question. She wanted to know, and this is around our board of directors as well, underperforming members of the board. What do you do about that?
Well, you really try to reach out to them and work with them closely, because there's a certain potential that we identify before we ask somebody to join the board, and certain, you know, really traits that they have from other organizations or in their professional life or personal life that we make that selection based on. And so often it's our fault. Often it's our fault. We haven't engaged them properly. We didn't find something that they really were drawn to. That's happened before. And then there's sometimes they get into a position. We had an attorney on our board, fantastic attorney, but things changed at the firm, and all of a sudden they were working day and night. And they said, you know, I'm sorry, things have changed. So we actually said, why don't you go to the advisory council so you don't feel all this guilt for, you know, you don't have to worry about missing meetings and all this. But then when things get back to normal, you let us know and we can rotate you back onto the board. But it's a 50-50 cause. I think sometimes we don't do a job. You know, who was it that said, you know, whenever he was turned down, I failed to convince you of my cause, or I failed to clearly state my cause here. It's my fault. And I think sometimes we have to be guilty of that.
And sometimes it is absolutely. You didn't do the right job, right?
Yeah.
Monica Sines has a great question. She wants to know about instances where you may not agree with the board. What do you do about that? That's an interesting question.
Well, yeah. Or put it another way, the board doesn't agree with me.
Yeah.
Well, I have no monopoly on right. I really don't. But we have discussions, and we'll usually take those offline. We'll go and meet in their office, talk on the telephone, and sit down, and then we'll figure out better why the board person feels so strongly one way and why I may feel so strongly another way. And we do have a 40-member board, and whenever a motion is made or a program is going to be initiated, it's a vote. And we have a board that's healthy. There are people that speak up when they don't think it's a good idea, and those that speak up when it is a good idea to them, and they vote, and whoever wins, we move forward. And so sometimes we agree to disagree. Sometimes they win me over, sometimes I win them over. These are all fine people, and you need a diversity like that. I think that you really need a diversity of people who will question things.
Absolutely.
If you had a whole board that just said, sounds good to me, sounds good
you wouldn't need a board then.
You don't.
Yeah.
So that's part of the diversity that you need. And if you have somebody, though, that is always on the outside and always in disagreement, they know that they're in disagreement, and everybody else knows that they're in disagreement, and at some point you just have a private conversation with them and say, you know, is this really, you know, is this service on our board, is this working out for you? Is this you know, because we just need to have this discussion. And a lot of times they'll be the first to say, you know, maybe this wasn't the right decision.
Well,
for me to make.
I call those the disruptive board members. That every once in a while you bring on a board member, and you don't realize this at the time, but it's sort of like they specialize in being disruptive, which is asking the wrong question at the wrong time, and really almost alienating the rest of the board, because the rest of the board's like, let's move on. I'm just tired of hearing this person.
On the other extreme, you can have a board that if one person disagrees, they'll say, well, we can't decide on this right now.
Right.
And that's unhealthy. That's really unhealthy. If you have just a person or two that feel strongly about something and the other 30 that feel strongly that we should do it, and they won't do it because they don't want to alienate these two, then you're frozen, you're stuck.
Yeah.
It's, you know, so there's a lot of dynamics in the board.
I also like the idea, and you hear sometimes the people who talk about this, that every controversial idea, they've really talked individually with board members first. So
Yes,
that
they will. Yeah.
when you get to that board vote, there's never a controversy, because it's sort of been talked about in committees or individually, and that's sort of a healthy way of going about it.
I spend a lot of time talking to our board. When we went through the transition from the sale of St. Joseph Hospital and went from St. Joseph Hospital Foundation to CHRISTUS Foundation, we spent a lot of time talking to the board and getting good input and following the tracking sheet of all the steps that we needed to take to make that transition, because people make decisions in different ways. And whereas one person can hear a case and say, oh yeah, let's do it. Another person, well, you know, I need to think about that. What about this? What about that? And so if you work with them individually, you try to, at the time that is right to make the decision, that most of the people are there. And so that's where that one-on-one work comes in handy, and respecting what they think.
The other thing is always asking board members, individual board members who might give you problems, asking them for help. It seems so simple, but you know, Les, I'm going to need your help on this vote. You know, people want to help.
Yeah, and the thing that they may resist the most, get them involved.
Yeah.
Because often information will change their minds.
Yeah, absolutely. Or change yours if maybe that person is right, as you mentioned.
Imagine that.
Samantha Coates wants to know about corporate partnerships. Do you guys have significant corporate partnerships?
Yes.
Yeah.
Yes, we do.
Who's your biggest corporate partner, probably?
I don't know who's the biggest.
Okay.
We have some who come to our mobile clinic sites and help us whenever we have a big day with a lot of patients there, and they'll help people fill out the forms. They'll answer questions. They'll kind of waltz them up. You know, a couple of organizations that have been real big in helping us are the H&R Block.
Yeah.
They help us a lot. And Smart Financial Credit Union, they help us a lot with with situations like that, and in volunteering to bring staff out to help us translate and to communicate and to handle more volume. Those are two exceptional. But we have a whole section of our website dedicated to our corporate partners. Wells Fargo has been a fantastic.
And even small corporate partners can grow into very big corporate partners. It's all about that relationship, right? And asking for help in some way.
It is. It's really, you know, I think that's where United Way really was brilliant when they have this day of caring. So they give a defined period of time that the corporations can come out with their volunteers, take on a defined task. We're going to need this supply, these skills. We're going to be there at 8. We're going to finish by 4. We're going to have lunch provided, and everybody's involved. And that's a good corporate partnership. And so we're trying to steal some ideas like that from United Way, because that very good formula works for us too.
Stealing ideas is really, it's one of the best things to do.
The last original idea was New Coke.
That didn't go that well.
It didn't go well at all.
Richard Kendall wanted to know what differentiates CHRISTUS from other health-related foundations.
Yeah, different missions, different models. You know, there's so. I said that there's 1 million people in Houston who don't have insurance, don't have access to affordable health care. So there's certainly a bigger job than what we can do. We're serving $60,000 and 60,000 people compared to 1 million. That's not many. So the other organizations all have their place. The federally qualified health centers really do a fantastic job of serving in some of the same neighborhoods just like where we're serving, with people who do have Medicaid and people who do have CHIPs, children who do have CHIPs. Children's health insurance.
Yep.
And then because of the revenue that they get from the reimbursement there, they're able to serve people who don't have insurance or people who can just pay a little bit. So our mission is really laid out as one that is, there's no guidelines, there's no qualifications. If you can pay, there is a fee. If you can't pay, we're still going to take care of you.
And that's a little bit different than most health. I mean, most health are really supporting a particular hospital.
If you go to the, you know, and I've been to the coroner emergency department before too on a weekend when I had something that just came up and I thought, I need to have this looked at. You don't have insurance, they're not going to take care of you.
No.
But we do.
Yeah.
We do.
Ashol Mayan wants to know about the competencies and skills that are most important for a development team, especially of a large group.
I think you have to be, you know, I don't know what the definition of difference is between optimistic and hopeful, but I think you need to be hopeful. I think you always need to see that there's chance, there's opportunities. I think you have to be perseverant. You can't just expect things to happen at once. You have to have a timetable and a plan and work with people, and you have to be a perseverant kind of person, a systematic kind of person. I think you don't necessarily have to be an outgoing person. I don't think that I'm an outgoing person, but I'm curious, and so I would sit down with you, Bob, and I would really be thinking about what I wanted to know about you and what you wanted to know about what our organization is doing. And so you need to have that curiosity and that ability to have a conversation with people. And you really need to look at the development industry or the development professional as somebody similar to an accountant, somebody similar as a banker, an attorney, because once you develop these close relationships with individuals, they're going to tell you things that they only tell their accountant or their banker or their attorney, and you've got to learn how to keep that confidential and work with them on that. And so you really have to look at yourself as that kind of a professional that people will confide in, that they will confide in you because they're trying to make decisions about what to do with their wealth. And they have enough wealth for themselves, they may have enough for their children and grandchildren, but they certainly don't want to leave it for the government to have after they pass away, and they want to put it to work in organizations fulfilling something that they're not able to fulfill in their lifetime. So if you look at yourself as a person who's just out asking people for money, you're selling yourself way too short. You have to be thinking of yourself as a professional in that respect, and so I think you have to have that self-image too, along with the other traits.
In our last couple of minutes, let me ask you sort of a couple of more fun questions. But before we do, work-life balance for you, Les, is it a hard thing, or how have you managed it over a career?
Sometimes, you know, you have your days, and your weeks, and your months. But I work for a fine organization, CHRISTUS Health, and they understand their work-life balance. And so I get up in the mornings, and I usually run. I try to play a little golf. I do some things around the house, that carpentry, you know, fixing things, because I live in a real old house. You don't really have much choice. And I have beautiful daughter and granddaughter, and try to spend time with them too. And it really just is, you're able to just escape your day-to-day.
So you feel like you have a pretty good work-life balance.
I do, and I think that's important. I think it's important, no matter whether you're a fundraiser or whether you're whatever you are.
Because we've had plenty of people in the seat that say there is no work-life balance.
Yeah, well, I work for a great organization that supports that, and in our organization we support that as well.
Yeah. Are you thinking about work all the time?
No.
No, okay,
I'm
that's
not.
good.
I'm not, but every now and then, it's you know, was it Edison? He said that the best ideas came to him in those little moments between wakefulness and sleep. And so he would sit in a chair and try to nap with a couple of dumbbells in his hand. This is, I think this is true. And just as he was about to go to sleep, his hands would release and the dumbbells would fall and hit the ground and wake him up. But that's when he had his most creative moments. And so when you're not thinking about work, I think is when you have your most creative ideas.
Yeah, interesting. The shower seems to me, I always hate wild ideas in the shower.
Painting the house, mowing the yard, you know, really things like that. Yeah.
Your favorite restaurant in town, Les?
Popeyes.
Popeyes.
That's my favorite.
Is that really your favorite restaurant?
Somebody asked me, if you would go anywhere on your birthday, where would you go? I say, I really like Popeyes. You know,
Yeah.
I really do like Popeyes fried chicken and rice and beans, and I like their French fries and their biscuits and everything. I love
Wow.
Popeyes. But I also like other restaurants. You know, a little place that probably everybody knows about, but I still find it kind of tucked away is the Thai Spice in University Village.
yeah.
The stairs up
Is that
there.
your favorite secret sort of place? I mean,
Yeah,
one
that
of the
would be
questions.
probably, yeah, kind of a secret kind of place, even though it's not a big secret. They certainly don't. Now it's not a secret. Everybody knows about it out there now. But they have great food. I love Thai food.
Yeah.
I love Thai food.
I love the Popeyes, though. That's sort
Yeah,
of
oh, man.
You know, it's really funny because we do potlucks every once in a while
Yeah.
at Children at Risk, and people always know that what I'm going to bring is like big buckets of Popeyes. So,
Is he just saying this, or is this true?
No, it's
You're-
absolutely
okay.
what I bring
Yeah,
always.
Yeah.
Because everyone, who doesn't like Popeyes, right? I mean, we always have a few vegetarians, but
I do
it's like the best fast food, I think. So
Do they-
I also like Frenchies, though. You know, I'll go out of my. Have you been to
Yeah,
Frenchies?
Of course I have, and
Yeah.
they're just not as handy as Popeyes. You know? They're a little closer by.
And when they do the Les Cave story in Hollywood, which actor are you going to have play you?
I
That's our
don't
final
know.
question.
Yeah, you know, you know, I don't even know the actors' names anymore. But it would be somebody who is kind of non-remarkable in the way they go about doing things, and plays a variety of parts. Somebody like what's his name? Kevin Spacey? Is that his
Kevin
name?
Spacey.
Yeah, somebody
There
like
you
that.
go.
You know, just
Kevin
kind of
Spacey. He's remarkable.
you know, just
Yeah,
but
you
he
can
does,
do a
yeah.
Kevin Costner as well. Sort
I
of
don't know
a.
about that.
You like Kevin
Yeah,
Spacey better. Yeah.
I don't, you know. Yeah.
Are you watching House of Cards? Have you watched House of Cards?
I don't.
Yeah, that's
I
a
did
Kevin
not. I
Spacey.
watched
You
the
may not-
Masters golf tournament. Now, if you want to talk about Masters golf tournament, talk about Bubba Watson. Now, I talk about that.
Les Cave from the CHRISTUS Foundation. Les, thank you so much for being on
It's
our
a pleasure.
program.
I hope this was helpful.
This was fantastic.
Anything
and,
I can do, let me know.
Students are loving it, I can
All
tell
right, I hope so.
already.
Thank you.
Thank you guys for being here in the Leadership Studio. We'll see you next week with another edition of Leadership Studio. Take care.